Hi, this is Tom Vasich, and this is the UCI Podcast video series. What's it like to be on the front lines of the largest human health crisis in more than a century? Dr. Chris Fox can tell you. He's the chair of emergency medicine at UCI, and he helps oversee the biggest and best equipped emergency room in Orange County. Each year, at least 1 in every 3 Americans visits an ER. That's 128 million visits nationwide. The ER has become the epicenter of U.S. medicine, and in Orange County, that epicenter is at the UCI Medical Center, where more than 50,000 people per year receive immediate trauma care. But the COVID-19 pandemic has considerably impacted how the UCI ER operates and the type of treatments it provides. Dr. Fox joins us today to tell us what's going on in the ER these days. Thank you for joining us, Dr. Fox.
Well, it's a pleasure to be here. Thank you for having me on.
What differences have you seen in the ER since the pandemic started?
Yeah, since the pandemic, we've noticed, first off, right from the beginning, initially our volumes went down right away. I think a lot of people were afraid to come to the ER, and I saw some surveys out there, and indeed, 4 out of 5 people thought if they came to the hospital, if they came to the ER, that they could actually catch COVID from another patient in the hospital. And I think that scared a lot of people away, and our volume went down to almost 50% of normal. Normally, we see about 150 patients a day in the ER over a 24-hour period, and we were seeing numbers, half of that somewhere in the late March, early April range, and it's been kind of trickling back up. But what is interesting, though, is that people are waiting a lot longer to come to the ER with their condition, and I can appreciate that. I think it's tough to know when to actually sort of pull the trigger and go to the ER for something. It's a lot of people, they don't want to come unless it's absolutely necessary. And it's hard for anybody, even myself as an emergency physician. Sometimes I wonder, should I go to the ER right now? And so I think with COVID, a lot of people in that little gray zone really held off, and they said, this chest pain, this abdominal pain, this slurred speech, whatever it is, I can hold off, and maybe it's going to go away on its own. I sure don't want to catch COVID. And I think that's one of the biggest things that we're seeing, is that people just delayed urgent matters until they became emergent matters. And now we're just admitting a lot more people than we were before. Usually we could send home the majority of the patients who come in, about 75% go. We treat them in the ED and then they go home. But now we're actually admitting quite a bit more patients than we had before. And so I just thought it'd be good to kind of explain, sort of that frame, that don't wait until the last minute to come, because there's a lot of things that we can do to help you before you're on death's door, so to speak.
Well, what are you learning about the nature of traumatic injuries during this time of social distancing and home self-confinement?
Yeah, so for trauma, we're a level 1 trauma center here in Orange County. We see over 4,000 trauma patients a year. And, we're right where the Orange Crush is, where the 55, the 22, and the 5 freeway come together. We see a lot of car accidents, a lot of motor vehicle collisions. And about 75% of our trauma patients are blunt trauma. The other 25% are penetrating trauma, like gunshot wounds, stab wounds. And there's a sprinkling of burns in there as well. But I could tell you that prior to COVID, our sort of bread and butter trauma patient was that motor vehicle crash. And a lot of that has to do, frankly, with alcohol. And a lot of people are in bars and drinking, and then they don't, for some reason, want to take an Uber, which still sort of boggles my mind. But they weren't taking Uber, and they were getting back in their car, and they were crashing into each other. And that was happening a lot, obviously. That's for years. That's why we exist in some ways. But with COVID and the bars being closed, people are sort of staying home and drinking and stuff. So they're not interacting with each other in a bar and getting into fights, and they're not interacting with alcohol and driving as much. And so that's my theory. We've seen a lot less of that, a dramatic decrease in the number of car accidents, and there's less cars on the road. There's less people just running into a possibility when they're changing lanes that they're going to hit another person or what have you. And so I think that's playing a big part of our demographic with trauma. But unfortunately, what we are seeing is more pediatric trauma. I think it's just parents aren't able to supervise their kids in the way they once were. I think, the parents are still trying to work and the kids are home from school and they're less supervised and getting into, trouble and less supervision. Certainly playing with devices that have wheels on them, like skateboards and bikes. And so we're seeing a lot of pediatric trauma, unfortunately. And I don't have the exact numbers, but I sense an uptick a little bit with some of the penetrating trauma as well.
What do you in the ER do when a person comes in who you believe is COVID-19 positive?
Yeah, so that's a great question, and I can assure you that we take every measure to screen every patient for any possible signs of COVID-19. So we have so first of all, no patients can even get into our waiting room or even anywhere into the hospital. They're screened outside under an awning. And, we have heaters out there at night and we have fans during the day, but this is a very outdoor process where they come in and of course everybody has to have a mask on their face regardless of it. That's just universal now. So if somebody comes walking up the ramp there and they're not wearing a mask, first thing we do is we give them a mask and then we are talking to them about their symptoms. We're saying, do you have any of the symptoms of COVID? And so some of the symptoms you think about, obviously fever, cough, sore throat, body aches and pains as a result of the fever. These sort of flu-like symptoms are very common. But there's also some other symptoms that we ask about that aren't as common and people don't always think about them. And so one of the symptoms that we see is loss of smell. And so we ask people about that, and it takes them a while to think about that, or loss of taste. And this is like you go to drink your coffee and it just tastes like hot water and you throw it out. You go, oh, I made my coffee wrong. That's usually one of the first signs that somebody's having loss of taste. Or sriracha doesn't taste spicy anymore. That's another really big sign. Somebody will say, yeah, I can't taste spicy food for some reason. It's weird. And or beer. Somebody who really likes IPA, suddenly it's like tastes like soda water. And so if somebody's having those types of symptoms immediately, we're thinking COVID, even without a fever or any of those other symptoms. And then some gastrointestinal symptoms like nausea, vomiting, and diarrhea, even loose stools would screen positive for potential COVID. And so, and then we check their temperature, of course. And so for all those patients, they would start over in the COVID side of the ER. And this COVID side is very well protected. Each room, you're in your own individual room. You're not like in the open area where we just have curtains. We put you over in your own private room. And so in some ways, it's a much better patient experience because you're not in with the mix with everybody. And then over there, you get the COVID test, and we get that test back in 2 hours. And then if it's negative, then you can join the other population. But if we're so suspicious, if we're like, boy, I'm surprised that test came back negative, we know that there's somewhere around a 15% false negative rate. So if you really do have a lot of the symptoms, but the test was negative, we might keep you in the COVID side and go from there.
One thing about your ER that's unique in Orange County is that you train so many medical students and medical residents. What's it like working with these young doctors and doctors-to-be during this really exceptional time in medicine?
Yeah, it's interesting you should say that. The young doctors and, like you said, the medical students, they're getting sort of a front row seat to this pandemic, because I think that a lot of society doesn't actually see the inside of a hospital, and they just hear about the pandemic, and they might see pictures on the news and they wonder, is this really happening? I think there's a lot of conspiracy theories and stuff out there. But what's wonderful is that for our trainees, they actually get to see firsthand what this pandemic looks like, and so for them, they're seeing how we handle all of their personal protective equipment. They're seeing how all the testing, all the results, how to interpret the results. and how to have a more of a public health approach to the pandemic. And they're seeing how sick the patients actually are. Some of them are very, very sick. And so, they're seeing those, and they're also seeing how people are waiting too long because they're afraid of COVID. So they're seeing a lot, the patients who are coming to the hospital are a lot sicker than they were prior to COVID in terms of non-COVID illnesses, like they're having a stroke, but they're really, having a stroke. They're having a heart attack. It's a severe heart attack. They have ruptured appendicitis. Some of the downstream effects of some certain types of conditions are being witnessed now by our trainees. And so I think that they're getting a really, sort of immersive, intense experience. Now, that being said, with the medical students, we do have a rule that no medical students themselves are permitted to go into the room of a COVID positive patient. Residents can, residents are doctors who are in training, but not medical students, not the ones who haven't become doctors yet. So they can still come to the hospital and help us out with our patients and learn and everything, but they're not allowed to be in the COVID rooms, the students themselves.
With restrictions being lifted and now Orange County not requiring people to wear masks in public anymore, what do you see happening this summer in your ER?
Yeah, so I have some strong opinions about that, and I think it's just the simplest thing one can do is to wear a mask out in public, just in case you're carrying it, or you may even be symptomatic and be spreading it. And so, if you could wear a mask to avoid other people catching what you have, I think that's, it's such a simple, easy thing to do, just for the next few months, maybe a year. Say you got to do it for a year. I mean, the science behind wearing a mask is so solid. It so helps us as a society, move forward and be with one another, even in the face of this pandemic. So to willfully not wear a mask, I fear that folks are really, that we're going to start to see the numbers really jump. So
you're expecting a surge?
Oh, we're seeing one, frankly, right now, because of what, during Memorial Day weekend, everybody was, so cooped up and they just couldn't take it anymore. They all went out and socially undistanced. And so we're seeing a little bump from that. And I worry that this summer, when everybody is, I heard the gyms are going to open, and, all these indoor spaces, bars, gyms, movie theaters, you think about a bar situation, right? And believe me, I love going out to a bar with my friends and drinking a few beers and interacting and, and goofing. And it's so fun. I miss that. I really do. And that's one of the things I'm looking forward to doing again someday. But not for another year. I can hold off. Like, I could definitely hold off, as much as I enjoy doing that. And so when you're in a bar, you're right next to somebody less than 6 feet away, and there's a lot of times there's music, there's other people talking, to really to get your point across, to be funny. You got to really raise your voice and really project it. And I fear that now that the bars are opening up and people are going to be near each other, and especially when you start drinking some alcohol, you really lower your social distancing, practice, so to speak. And I feel that we're going to see a potential spike here. And I'm nervous about that. I just wish that we could be a lot more strategic and have a more surgical approach to this, if you will, and really prevent certain activities from happening. But, it is what it is. So I think that wearing a mask in those situations is our only line of defense that we have left, and since everything's opening up. And I just really hope that people heed those mask warnings.
Going back to something you mentioned earlier, when should patients go to the ER?
Yeah, I think that's a bit of a gray area for some people, right? It even is for me. In fact, it was last weekend. Yeah, almost 2 weeks ago now. My wife was on her e-bike, and she was riding down our street down here in San Juan, and she accidentally put her front brake on too hard, and her bike went down, and she bit it pretty hard. And I heard the crash. I turned around. I came over to her. Her neck was bothering her. And I said, what do we need to do here? I thought, here I am, the chair of the Department of Emergency Medicine. If anybody can, know what to do, it'd be me right now. But it was hard to tell. Her neck was tender, and I thought she could have broke her neck. And so but it wasn't obvious. It was like sort of a gray area. So I erred on the side of caution. I brought her to my own ER. And in some ways that just shows you that, I'm not worried about her catching COVID in my own ER, obviously, because otherwise, I wouldn't have done that. But I brought her in and we got a CT scan of her neck and it was normal, and some other x-rays of her shoulder and stuff. It all came back normal. And so I think it's, I understand people when they say, I wasn't sure if I should come in. And sometimes patients even apologize. Like, I'm sorry, I said, no, you're not wasting our time. No, we love to be here for you guys. This is why we're here. And so I think that, but to get to your question though, what are the things people should be coming to the ER for? Chest pain is a really good one. That's something, chest pain is not to be ignored. And there's story after story of people during this COVID period of afraid to come to the hospital with chest pain and end up having a heart attack at home. And, and chest pain is one of those things where we have an amazing cardiology service who can whisk you to the cath lab and unclog your artery, like, in the first 30 minutes of arrival. We just had one yesterday, actually, a really cool case where that happened very quickly. And the outcomes for people in the first stages of a heart attack are outstanding. And I would say the same thing with stroke. It's the same concept, right? It's a little blood clot that goes up to your brain, and now part of your brain's not working, and we can unclog and bust that clot quickly, and you can be completely 100% functional and normal again. But if you're having signs of a stroke, weakness, slurred speech, trouble getting the words out, what we call expressive aphasia, or it might be something like with blurry vision, sudden loss of vision. These are things that you need to come right away for. And don't apologize. Just show up. We'll be happy to see you and make sure you're safe. Other things, abdominal pain is another one. Gallbladder attacks. Sometimes these gallbladder attacks can go on and can make you really sick, and you can get gangrene of your gallbladder, and it could actually kill you. So abdominal pain is something that we all take very seriously. Abdominal aortic aneurysms and folks over the age of 60 who have a history of high blood pressure, these things can rupture, and the faster you can come to us, the better chance of survival. Appendicitis. I took care of an appendicitis patient today, actually, who came in early in the course, and I thanked her for that. Because the appendix can burst, and we had some cases last week of appendix that several cases where they burst, they ruptured, and then all the pus spills out into the abdomen and can get into the bloodstream. You can get septic and die. And so 7% of people will get appendicitis. And so we just have to be aware of that and be cognizant of that and come to the hospital when we're sick. Dehydration, skin infections is another one that commonly can be treated very easily with antibiotics. And, sometimes you could see your doctor as a virtual visit, on the phone for some of these things and get the antibiotics as an outpatient. But if you're not able to get that kind of access, then we're here, we're here for you. So, but you wouldn't want that skin infection to become a bone infection or a really bad abscess that could have been treated easily first with antibiotics. So.
Well, one last question is, do you have any other advice for listeners about COVID-19, their health, and their neighborhood emergency room?
Yeah, I think COVID-19, it's a very interesting time, obviously. I think my best advice is to practice safe social distancing and kind of look at the long-term ball, right? Like, look at it, just say to yourself, I got to wear these masks for a year. I'm going to be 6 feet apart for a year. And hey, maybe a vaccine will come on the scene sooner than that. And if that happens, wonderful. But just kind of get into stay strong with the social distancing and the hand hygiene and and by social distancing, 6 feet apart. I think it's really hard to catch this outside. And I think when you're indoors in a closed space, in a restaurant, in a grocery store, that's really like when your senses need to be high and you got to have those masks. But I think, and be 6 feet apart. But I think that when you're, outdoors and hiking and, in the ocean and in a swimming pool in your own lane, these are things that I think are just need to happen. And we just need to learn how to live with this and know when to wear a mask, wash our hands, and stay 6 feet apart. And the ER is doing every single possible thing we can to clean off all our surfaces and ensure that everybody has a safe experience as they come to the hospital.
Well, thank you, Dr. Fox. The UCI Podcast video series is a production of UCI Strategic Communications and Public Affairs. For more about all things COVID-19, go to oc-covid19.org. I'm Tom Vasich. Thanks for watching.